We have the American Heart Association recommending only 5 to 7% of your total calories come from saturated fat, and all these cardiologists recommending lower LDL levels. That comes from somewhere. So why do you think you and the rest of them have such a different paradigm on that?
So I think for a minute we should not talk about how this hypothesis, the diet heart hypothesis, came about. We could spend the entire hour talking about it and say how wrong it is, and how poor the science is behind which it is based. But let us suspend that for a minute, and maybe we can come back to it. But let's look at the data that shows that LDL is good.
Okay.
Very briefly. So you take a 50,000 patient study called the HUNT-2 trial, and I think I send you a link to that. And these patients were followed for 10 years. And if you look at total mortality, the higher the cholesterol, the lower the mortality, especially in women. And in women, if you looked at cardiovascular mortality, higher your total cholesterol, lower the mortality. Now, total cholesterol correlates very good with LDL cholesterol. So when your total cholesterol goes high, so does your LDL cholesterol. So that's what these guys observed. So that is one very robust piece of information. Now, second thing is that I want to take you back to a couple of observational studies that are highly significant. Let's take the one that was done in Edinburgh, England, or Scotland rather, and they took about 1,000 people. Now, this was a cohort. People born in the early 1900s, they went through a mental status examination at age 11. And when they were about 70 years in early 2000s, they were brought back for a repeat mental status examination, examining their cognitive skills, their verbal skills, their IQs. And all of this was correlated with cholesterol levels. So they said, hey, if somebody has very high cholesterol, which is in your range, which is 250 and above, and compare them with middle cholesterol, which is between 200 to 250, and then compare them with people with lower cholesterol, which is less than 200. And then you try to say, hey, who has the best cognitive skills? Who has the best memory recall? Who has the best IQ? And across all these parameters, the uniform finding was that people with higher cholesterol had better verbal ability, better cognitive skills, and better IQ. And not just that, when you looked at other aspects like high blood pressure, strokes, and heart disease, people with high cholesterol had lower incidences of all of these three factors: lower hypertension, lower stroke risk, and lower risk of cardiac disease. So whenever you are looking at a study that says high LDL is bad, reducing the LDL is good, you want to stop for a minute and try to reconcile those observations with the observations that I'm pointing out, that there is a lot of disagreement. Now, I'll cite one other study, and then I will pause for a minute to let you recollect your thoughts. And this study was done in the town of Leiden, Netherlands, and they took people who were over age 85. I think they found somewhere in the range of 768 odd people. And they followed these people for 10 years. So 85 and above, following them for 10 years and looking at total cholesterol and different outcomes. So again, they divided them very similarly: 250 and higher as the high cholesterol group, 200 to 250 as the middle cholesterol group, and less than 200 as the low cholesterol group. And what they found is very similar to the Lothian birth cohort that I described. Higher cholesterol was associated with lower cancer risks, lower all-cause mortality, and something very important, which I would probably ask you to relate to your personal experience, is that they had a lower risk of infections. If you look at old people, one of the primary reasons they die is because they get pneumonia. And the rate of pneumonia in people with high cholesterol was much lower than the group with low cholesterol. Now, if I were to ask you and say, hey, ever since you went on this low carb diet and your cholesterol has shot up into the 300s, have you noticed a reduction in the common colds, the respiratory infections, the minor infections that you used to get? And in all likelihood, you would say, yes, I have observed that. And I don't know whether it would be an anecdotal truth in you, but I can tell you that is my personal observation also.
Yeah. I think for me, so right now it's been 10 weeks, so I don't think there's been enough time to really conclude anything. I haven't gotten sick in those 10 weeks, but I also don't tend to get sick very often in general. So it'd be hard for me to, add to that anecdote, I'd say.
Mm-hmm. Sure. I can understand that.
Yeah. So can you go a little bit more into the role of LDL as far as, what benefits it had or it has on the body? I know there was a rat study relating to bacteria quorum sensing, and, as far as bacterial load, how the LDL helped there.
Now that is fascinating, and I love talking about that.
Mm-hmm.
So they took a group of rats and they injected them with this bacteria, which is called Staphylococcus aureus. It's just something that causes pneumonia and skin infections. And this bacteria is quite amazing because before it starts multiplying in the lungs, it sends out these protein molecules. And these protein molecules are just like a pilot that the bacteria are using to see if the environment is favorable for them to multiply and gain foothold for infection.
Mm-hmm.
So that sensing protein it sends out is called quorum sensing. So the protein goes into the lungs and it comes back and gives feedback to the bacteria saying that, yeah, this environment is favorable. Let us multiply and take over the host. And these researchers did an amazing thing. They looked at LDL cholesterol, which we call as the bad cholesterol. And in a series of biochemical experiments, they described and showed to us that the LDL cholesterol is the one that neutralizes this quorum sensing protein. So LDL mops up this quorum sensing protein. And since it mops it up, the bacteria thinks that, hey, this is not a favorable environment for us to multiply. And so your chances or your risks of getting an infection fall way down.
Do you think that mechanism is the primary or only mechanism by which the lower carb, higher fat diets help people, get sick less often?
I think that the paper also described a few other factors. One of them is called lipopolysaccharide neutralization. So what lipopolysaccharide neutralization means is that the LDL molecule mops up this protein that the bacteria are releasing that causes inflammation. Inflammation is a primary cause for people falling sick and not doing good. And since the LDL molecule neutralizes it, that is another way in which it would reduce infection and the morbidity, or in other words, the symptoms of infection.